So I got this prednisone warrior question about joint pain while on prednisone, and is it normal? So he asks, so I've been on prednisone daily without fail for 13 years due to a neuromuscular disease, myasthenia gravis. I definitely feel my joints and muscles hurting, weakening, and sometimes seem like they are shrinking even. Is this normal for prednisone and for this long on it? I'm only 42, so I have a long time left, and hopefully I won't be hurting the whole time due to joint pain. What's really interesting about this side effect that you're experiencing joints and muscles hurting is I had personally never heard of it when I launched my career as the prednisone pharmacist. This is not something anybody ever mentioned in pharmacy school as a side effect of prednisone. And I really thought people were making it up. I was like, no, prednisone doesn't cause joint pain. It helps joint pain. It's like the number one thing it's prescribed for is rheumatoid arthritis joint pain. And so I was really confused about this. But then the more I listened to people, the more I realized it was real. And just to legitimize the realness of it, and then I'll tell you a story of one person, is I created this ultimate list of prednisone side effects. You can search it on my website. You can link to it from the homepage anywhere. But basically, I compiled every single list of prednisone side effects from everywhere I could find them and made it searchable so that you could see, is this a side effect of prednisone or not? And the reason you have to be able to search it is because every single list is different. This prednisone is such an old drug, there's no actual complete list until now when I created it. So basically, you go down here and you go to the search box and you say muscle pain. Is there anything that's called muscle pain? Muscle pain right here. And it's one of the musculoskeletal things. This actual term is called myalgia. And what about joint? So, and again, in the musculoskeletal category, the side effect is called arthralgia, joint pain. And then let's go back to muscle. You mentioned weakness, muscle weakness. So that's myasthenia. So it's really tricky to answer your question because you say you have myasthenia gravis, and the other word for this type of side effect is also myasthenia. So is it your disease or the drug side effect? And that's not a question I can answer. That's one you definitely have to cover with your doctor. But what I can say is that one source, one list of drug side effects included muscle pain and joint pain on the list. And that's clinical pharmacology. It's the only one. These other well-respected medical drug references did not include those as side effects. I don't know why, aside from it's a really old drug and nobody actually ever published the list of side effects until they just kind of randomly compiled them. There's no drug manufacturer that had to do it. So only clinical pharmacology listed these as side effects. So is it legitimate or not? According to clinical pharmacology, which is my very favorite one of all, it is legitimate. Can prednisone cause aches and pains? Yes, prednisone definitely can cause aches and pains, from muscle pain to joint pain as side effects of prednisone, which seems so backward since prednisone is often prescribed for aches and pains, such as rheumatoid arthritis joint pain, but it can happen. Is it normal for muscles to hurt, weaken, or shrink while on prednisone? Yes. Prednisone can cause muscle changes from muscle pain to muscle weakness, which is called myopathy, to muscle loss, which is called muscle atrophy. Muscle pain could also be a symptom of prednisone withdrawal, so it's hard to tell, and it's best to discuss that with your doctor. Extreme muscle damage is possible from prednisone, but it's really rare. Check out my Prednisone Warrior story all about Steve. But since myopathy or prednisone causing muscle weakness is the most common muscle side effect of prednisone, we're going to focus on that for the rest of this video. Muscle weakness typically develops with doses higher than 10 milligram equivalents per day used for 4 weeks or longer, but it's possible with short-term or very high doses. So what are the symptoms of myopathy or muscle weakness from prednisone? As is kind of obvious in the term, the main symptom is muscle weakness. What's important is that it's on both sides of the body And the most common place is in the hip muscles. The muscle weakness is most common in the legs, the upper leg area where it inserts into the hip. Myopathy typically doesn't cause pain. So if you're having muscle pain from prednisone, it's usually not myopathy. Myopathy usually gets slowly worse over time while taking prednisone. And you might notice having a hard time rising from a seated position or climbing stairs. And if you're having muscle issues, definitely talk to your doctor about it. We'll cover more about what doctors can suggest below. How many people on prednisone get muscle weakness or myopathy? The medical term is corticosteroid-induced myopathy, and it's the most common myopathy caused by any drug. So other drugs can cause myopathy, but prednisone is the most common drug to cause it. And what stunned me was to find out that it's an incidence of 50 to 60% among those who use corticosteroids for a prolonged period. I really was shocked to see that more than half of people who take long-term prednisone are likely to have muscle weakness. And who's most likely to get it? It's more common in the elderly, women, people with cancer, respiratory conditions like COPD or asthma, poor diet, and people living a sedentary lifestyle. How does prednisone cause muscle weakness? So glucocorticoids, like prednisone, change how our bodies use protein. They alter protein metabolism and sugar metabolism too. Prednisone slows down the making or building up of protein in the muscles, and that's called anabolic metabolism. However, the main way prednisone causes myopathy is by causing muscle breakdown, which is called catabolic or catabolism. Prednisone is both breaking down muscles and slowing down the building of them back up. Other causes of prednisone muscle issues could include changes in electrolytes, like potassium and calcium, or other nutrient deficiencies like vitamin D. Prednisone depletes at least 9 nutrients, so the nutrient depletion could affect how muscles feel while on prednisone. How do doctors treat muscle changes? Prednisone myopathy. Ideally, they prescribe the person to stop taking prednisone. And if so, to see if the muscle weakness gets better in 3 to 4 weeks after stopping. However, and this is a big however, most people can't and shouldn't do that because of the need for long-term steroid treatment. You should never stop taking prednisone without talking to your doctor about it because stopping can be fatal. But if your doctor chooses that as a treatment, if prednisone is stopped, when will you recover from prednisone myopathy? Recovery can take weeks, months, or even a year, but this is a reversible side effect. It is not an irreversible side effect like osteoporosis, bone loss. Muscle loss is reversible, bone loss is irreversible. So what can you do to reverse these muscle changes from prednisone? They've done several studies about this, and they've discovered that exercise is effective for both the prevention and the treatment of muscle changes from prednisone. One study showed that physical therapy with resistance exercise is effective for both muscle atrophy, which is muscle wasting, and muscle weakness, which is myopathy. Another study showed that aerobic physical training can reverse, as they put it, glucocorticoid-induced muscle wasting in patients taking a low to moderate dose of prednisone. So that is great news that exercise can help reverse it. Eating a diet with enough protein makes a lot of sense because we're having a hard time with protein metabolism, but there are no great studies showing the effectiveness of this yet. And then finally, if you want to prevent muscle changes caused by nutrient depletion, as mentioned above, of potassium, calcium, and vitamin D, you can replenish these nutrients that have been depleted by prednisone. Eating a diet high in these nutrients is the best and first way you should replenish these nutrients. However, it can be pretty hard to eat a diet that's high in potassium and high in vitamin D because very few foods have vitamin D in them. So often supplementation is needed to get these nutrients into your body. That's one of the reasons I invented Nutrinite Zone. It's the first and only supplement designed to help you reduce your suffering by replenishing your nutrients so that you can recover from taking prednisone. It contains potassium, calcium, vitamin D, and 14 other vital nutrients and herbs for people on prednisone. And you can find it at nutrinize.com. And then let me tell you the story of Linda. She is a prednisone warrior who's very vocal in Facebook support groups. And so I'm just going to search this page for pain. So first, she was really happy because it relieved pain. That's what this paragraph is about. Then tapering, and the body pain became almost unbearable. I got down to 1 milligrams and felt dizzy, nauseated, exhausted, and had terrible body pain. I could hardly walk. I called my doctor and he told me that I went too fast and should go back up to 10 milligrams and taper more slowly. So this is exactly what I would tell most people is if you are having this terrible body pain, often it is a symptom of prednisone withdrawal. And that means that you're tapering too quickly off of prednisone and your body is having a reaction. But in your case, it could be the myasthenia gravis. So I don't know. It's really something you're going to have to bring up with your doctor. It is a possible side effect of prednisone. Prednisone is really hard on our bodies. It's like stealing from our muscles and our bones and our skin vitality to keep us alive. And so it is stealing from your muscles. It is causing muscle problems. And whether it's the drug or your disease, that's where I can't actually tell you for sure. So that's where my disclaimer comes in that this is not medical advice. Definitely talk to your doctor about it. And I'm really basing this on the very limited amount of data you've shared with me. So they know more about your situation and can help you decide in a better way. Signing off is Dr. Megan, your prednisone pharmacist.